right, thank you guys for joining us for another workshop in the HSC Nutritional Sciences series that our students have been providing this spring. So this one is covering importance of vitamin D in our diet. We have Jess, Melissa, and Tisha joining us today. So great topic here. Love the variety of topics that we're getting from the students to cover many things. So please encourage you guys, drop those comments, questions in the chat, and we'll get through this information today and really looking forward to it. Thank you, ladies. Go right ahead.
Hi, everybody. We're so excited to be able to talk to you guys today. Like Lindsay said, I'm Jess.
I'm Melissa.
And I'm Tisha.
And we are all first year students here in the dietetic program on campus. And we are here to talk to you guys today about the importance of vitamin D. Like Lindsay also mentioned, if you guys have any questions throughout our presentation, feel free to drop it in the chat. We will be checking that, and we'll have at least one of us checking it the whole time, but we'll also have a time for questions at the very end if you'd prefer to just ask it face-to-face to one of us. So it is completely your choice, and we're excited to get started. And these slides will be sent to you as well. Just to start us out, we do have a pre-assessment quiz we would like you guys to take. And I just dropped that link in the main group chat as well, just in case the QR code isn't scanning for you or you don't have your phone. So you're more than welcome to click on that link as well. And we're just going to give you guys about 2 to 3 minutes. It's just a multiple choice questions, just so we can get a range of your guys' knowledge already about what you think about vitamin D and if you currently take a supplement. And then we'll have you guys take another post-assessment afterwards and see if there's any change. Okay, so we're going to wrap up the pre-assessment now, but if you're still working on it, no worries. Feel free to go ahead and submit your responses whenever you're finished. But we are going to go ahead and get started with our presentation.
Hi, everyone. So today in our discussion of vitamin D, I'm going to give a quick overview as to what we're talking about today. We're going to start with the introduction of vitamin D and the vital role it plays in the body. We're going to identify a few sources of vitamin D, outline signs and symptoms of a deficiency in vitamin D, as well as outline the relevance of vitamin D in prevalent diseases and how to properly supplement it. Hopefully from our presentation, you guys will be able to answer. We'll be able to explain the purpose of vitamin D, what comorbidities vitamin D supplementation may prevent or slow, as well as be able to list who is at risk for a vitamin D deficiency. To start, vitamin D is also known as calciferol, is a fat-soluble vitamin, which basically means when too much of it in the body is taken up, we'll store it in our fat stores rather than such as a multivitamin, which is water soluble and will be excreted pretty quickly. Vitamin D is found in few foods and is also fortified in others. It is made in our body by sunlight, and it can also be a dietary supplement. Vitamin D's basic job is to promote the absorption of calcium in the stomach. We know that calcium is important for bone growth and retainment, and so we don't ever really think about the role vitamin D may play in it, but vitamin D helps our body utilize that important calcium for our bones. Some sources of vitamin D. There are 2 known occurring sources of vitamin D. It's vitamin D2 and vitamin D3. Vitamin D2, commonly found in mushrooms and other plants, is known as the non-active form of vitamin D. Because it's the non-active form, it must go through an additional process to become vitamin D3 and to be able to be used by the body. So not saying mushrooms aren't a good source, it's just not as a readily available source of vitamin D. More food sources of vitamin D include oily fish, such as salmon, beef liver, and egg yolks. Because not a lot of sources contain vitamin D, it's often fortified in foods. Food fortification basically means that if a nutrient is not present or has low amounts, it'll be added into the food. Oftentimes dairy products, depending on where you're at in the world, are fortified in vitamin D. Also orange juice, cereal, and soy milk. Lastly, the most important or the largest source of vitamin D is sunlight, depending on where you are in the world. The sun, UV rays from the sun interact with the protein on our skin and help to create vitamin D3, which is the active form. Research is starting to show the suggested amount of time spent in the sun to get adequate vitamin D. Right now, their guesstimation is between 5 to 30 minutes a couple times a week. However, because research is new, it's not a hard and set rule. It's just recommended to try to get out and get in the sun as much as possible. Yep. So why is this important? Why are we all here today? Vitamin D deficiency is exceptionally prevalent, especially in the American diet. It's estimated that about 42% of Americans actually have suboptimal vitamin D levels. They're not yet considered deficient, but are pretty close. And just because it's a suboptimal level, you'll still see some issues similarly that you would see in deficiency. Unfortunately, this number increases drastically with our Hispanic population at 63%, as well as 82% in our African-American population. Signs and symptoms of vitamin D deficiency include fatigue, bone pain, and loss of density. This kind of goes with the whole idea of calcium is important, but vitamin D is just as important for getting that calcium into the bone. Other known symptoms, muscle weakness, aches, cramps, again, all tie into the calcium. Something notable though is that vitamin D deficiency is being shown to have changes in mood or affect changes in mood, and they're actually starting to see that find a relationship between low vitamin D levels and people that suffer from depression. So they're starting to think that supplementing with vitamin D may actually help to improve this. Vitamin D deficiency is also contributed to Rickets disease, most often found in children, osteoporosis, and bone fracture. Next, we were going to talk about prevalent diseases in vitamin D with Tisha.
Hi, guys. So we're going to start with diabetes and why it's important to make sure you have adequate vitamin D if you have diabetes. So 37 million Americans have diabetes, and 90 to 95% of those people have type 2 diabetes. These numbers are higher, but there are just a lot of people who have diabetes and they just don't know it. So vitamin D actually affects glucose control, or blood sugar is what it's more commonly known as. Vitamin D is related to blood sugar control and type 2 diabetes. There's an inverse relationship between vitamin D and A1C levels. So for those of you who have diabetes or close with someone with diabetes, A1C level, you're probably familiar with the term A1C levels, but just in case for people who don't know, A1C levels, if you have diabetes, you really want those numbers to be, that number to be low. So if you have high A1C, that's not really good if for someone who has diabetes. So the lower your vitamin D levels are, the higher your A1C levels tends to be, is what they found. So vitamin D deficiency is very prevalent in populations with type 2 diabetes. And those include African Americans, Hispanics, Native Americans, Pacific Islanders, and Asian Americans. And and the reason why it's commonly seen in these populations is due to melanin. I know Melissa earlier talked about sunlight and vitamin D production in the skin. So melanin, even though it protects you from UV lights from the sun, it also slows down vitamin D production. So because UV light blocks that production of vitamin D. So that's why you're seeing these populations are more at risk for vitamin D deficiency. So the darker you are, the more at risk you are. So it is beneficial to recommend vitamin D supplementation to improve blood sugar control and type 2 diabetes. Next, we're going to move on to osteoporosis. And osteoporosis, I'm sure most people know, but if you don't know, it is a skeletal disorder resulting in increased bone fragility and fracture. And this can be due to inadequate vitamin D intake. So what's the relationship? Vitamin D deficiency can lead to osteoporosis because vitamin D helps with the absorption of calcium in the gut. So calcium is needed for strong bones, as we've all heard in our lifetime. So vitamin D supplementation can decrease bone turnover and increase bone density. So in other words, you are building more bone than you are just breaking bone down. So people who are most at risk are older people over the age of 60, though it is very possible in young adults, rare, but it can happen, and usually women who are white or Asian. So vitamin D is usually recommended for the prevention and management of osteoporosis. And I do know women, especially who are over 50, postmenopausal women, their doctors have recommended that they take vitamin D and calcium to try to prevent osteoporosis. So multiple sclerosis, MS, is a chronic inflammatory and degenerative disease in the central nervous system. So there are about 1 million people in the United States who have been diagnosed with MS. The cause of MS is unknown. However, there is evidence, strong evidence to support that vitamin D deficiency can lead to the development of MS. So what's the relationship? Vitamin D and the onset of MS is related to the vitamin D's role on the effect of the immune system. So MS progresses with low vitamin D levels. And it's also seen that with low vitamin D levels, you see an increase in relapse and disability rate in people with MS. So people with MS as part of their treatment plan, they are advised to supplement vitamin D to reduce their risk of their symptoms. And it's also just kind of recommended for the general population in general, just to supplement vitamin D to prevent the onset of MS. So vitamin D and respiratory diseases. There is a strong relationship between vitamin D and lung disorders. So cystic fibrosis, 90% of people with CF are vitamin D deficient. Vitamin D supplements are usually given in the early stage of CF as part of treatment. In asthma, especially in children, low vitamin D levels are linked with the severity of asthma. And women who are low in vitamin D are more likely to have a child with asthma. COPD, the major leading cause of worldwide mortality. COPD severity and vitamin D levels are inversely related. So again, the lower your vitamin D levels, the more severe your COPD will be. So supplementation has been shown to improve the quality of life in people with COPD. And with pneumonia, vitamin D deficiency may cause hospitalization in patients with severe cases. So if you get pneumonia and your vitamin D levels are low, there's a chance that you may be hospitalized. And of course, the big one, COVID-19, that's really relevant to us today. COVID-19, which is a respiratory infection. Again, we're going back to the lungs, which is also known as severe acute respiratory syndrome coronavirus 2, which leads to acute respiratory distress syndrome. There is a strong, I'm going to emphasize this, relationship between vitamin D deficiency patients and the severity of COVID-19. Of course, again, darker skin tones are most at risk due to that melanin that prevents sort of that production of vitamin D. Vitamin D patients are typically older, they have higher hospitalization rates, they require intensive oxygen therapy, and they have the worst survival rates. So vitamin D supplementation may reduce infection risk, and there is enough evidence for physicians to use vitamin D as part of the treatment plan in COVID-19. All right, next we're gonna move on to Jessica.
Hi guys. And so we've talked a lot about how vitamin D is especially important to help with disease states or maybe later on in life once you've hit menopause as well, especially for women. But vitamin D is also going to be very important in the earlier stages of life as well, specifically if you or your partner are wanting to get pregnant. And so a big thing in prenatal care, especially in terms of nutrition support, is you want to start making those changes 3 to 5 months before conception. So that way during the whole conception process and pregnancy, you're not worried about being deficient, but you've already addressed those things. So if vitamin D deficiency is something that you may be concerned about after hearing this presentation, these are going to be some of the side effects that are associated with deficiency during pregnancy. And so the major one is preeclampsia. And so if you're unfamiliar with what that is when during pregnancy, usually around 20 weeks, you get very high blood pressure. And this can also cause swelling of your hands and feet, as well as long-term damage to organs if it's not properly addressed. And this is because as you have that high blood pressure, your organs are working overtime to try to fix that, as well as make sure that the fetus isn't receiving any damage from that. So with preeclampsia, if you have this and it is associated with increased mortality rates among children after they're born if the mother or the fetus have it during pregnancy, as well as it can lead to long-term complications for both the mother and fetus, as well as even in rare or extreme cases, death for the mother and fetus, which is why this is something that we want to make sure we are absolutely avoiding if possible during pregnancy. And so we'll talk a little bit later about actual dosages, but during pregnancy, your vitamin D needs are going to increase just to make sure that enough is going both for the mother's needs, but as well for development of the fetus. And interestingly enough, we don't know for sure the mechanism behind this, but a vitamin D deficiency is associated with the development of asthma if you're deficient during pregnancy once the child is actually born, as well as type 1 diabetes for the child. As we know, type 1 diabetes usually occurs for children. It didn't say whether or not it affects development of gestational diabetes for diabetes for the mother, but for the fetus itself, we are concerned about seeing asthma or type 1 diabetes develop after birth. So vitamin D supplementation or getting it through your diet or physical activity, sunshine, that's going to help improve maternal health, fetal development, and postnatal life. So the recommended dose for pregnant women or people wanting to hopefully conceive within the next few months is going to be 4,000 IU. And so that's a little bit higher than your normal dose that just an average adult would need because you don't want to over supplement with stuff. But during pregnancy or during conception, 4,000 IU is going to be the recommended dosage. And vitamin D is just also seen to have an association with overall lessened mortality. Again, the mechanism behind this isn't quite sure, but it could be because it has an influence on so many disease states as we've seen, as well as during development as a fetus, it is associated with better health outcomes that just overall we're seeing lower numbers of mortality with those who have adequate vitamin D levels. So it also is associated with a reduced cancer risk by 15%, and as well as lowered chances of cardiovascular disease, which as we know is a very large problem in America and specifically in Oklahoma. I believe we currently are the #1 leaders in heart disease related deaths. And so while clinical data on vitamin D is still relatively foundational, so we're looking more to see how it's directly impacting mortality. And so that definitely still needs to be studied. But so far, the research shows that vitamin D is extremely important just for to not develop those disease states, to have better health overall, as well as to make sure that your bone health is strong as well. And so like I said, more research is needed, but these are new pieces of research are starting to come out to see how it just might overall have an effect on life expectancy and life quality as well, in addition to the specific disease states that it can help prevent or reduce complications of. So supplementation. We aren't here to recommend that everybody takes a vitamin D supplementation. There are, like Melissa talked about, there are definitely ways to get vitamin D solely through your diet, as well as through sunshine. As we know, sun is probably the biggest exposure most of us have to vitamin D, hopefully. And so if you have sufficient vitamin D levels, there isn't a need to over supplement, but we just want to make sure that people who are listening to this presentation, your friends and your family, that you are all meeting that adequate vitamin D level. And so that's something that too, you can get clinically tested when you go for your labs with your doctor for your yearly checkup. They can check your vitamin D levels and tell you whether or not you're deficient, or you can also see if you are maybe having some of the symptoms we've talked about of deficiency. You might be interested in learning how to supplement. And with vitamin D, it's a relatively inexpensive supplement if that's the route you choose, and it can be picked up at most grocery stores or convenience stores. And so the Mayo Clinic recommends 1,000 to 2,000 IU per day, but at least 600 IU to avoid deficiency. So if you don't want to supplement, that's perfectly fine, but we want to make sure that you're at least getting 600 IU from your diet or from sun exposure. For optimal benefits, like we've talked about, preventing these disease states or helping reduce complications during pregnancy or while it being in a disease state, that's when you would be hitting that 1,000 to 2,000 IU per day. And so different factors that affect absorption is age. As we grow older, our receptors are downregulated, and so it is harder to just naturally absorb that vitamin D from both food and from the sun. So like Tisha and Melissa mentioned, once you hit that menopausal age around 50, but also for men, once you are starting to get older, your body just naturally downregulates its absorption. So that is something to consider, is past the age of 50 to 60, if you are maybe not able to absorb it as well as your ethnicity. The more melanated your skin is, the harder it is for you to absorb vitamin D directly from the sun. And like Tisha mentioned as well, there are certain factors for disease states that may make you more interested in supplementing, such as white women and Asian women being more likely to develop osteoporosis, and vitamin D's clinical benefits in reducing bone weakness. Latitude is also going to play a part. The closer you are to the sun, or not the sun, but the equator, the more chances you are that you're exposed to vitamin D and that you have vitamin D or sunlight for longer parts of the day. So if you are, in a less tropical or a more cold environment, that's something to consider, that even if you are outside, how much sunlight are you actually getting, and how much time during the day is the sun actually out in the climate that you live in. As well as season, as we know, spring and summer, it's going to be easier to get that vitamin D as the sun is out more and it's hotter, and you're just more likely to be outside in that time versus when it's cold. We know that you tend to stay home indoors. So that's something to consider, is during the fall and winter, in order to make sure that you're meeting your daily intake of vitamin D, eating more fruits and vegetables that contain it, making more of an effort to sit by a window, etc. Those things are going to help with fall and winter, especially in terms of energy. And like we mentioned, sun exposure and also clothing. If you're outside but you're fully covered, only your face is really getting that sun exposure. So you want to make sure that if sun exposure is how you want to get your vitamin D in, that you're dressed in a way that you're actually getting it from more than just your neck and your face. So if that's in the privacy of your backyard or your home is where you want to do that, that's absolutely fine. But just being mindful about how you're dressed if that's your way of getting in your vitamin D. So we also wanted to mention adverse side effects. Like we said, if you already feel as if you're getting enough vitamin D from natural sunlight exposure and your diet, there is not a need to supplement, because we don't want you to have too much vitamin D. There hasn't been an upper limit officially established yet for vitamin D. However, we've seen that too much vitamin D can lead to adverse side effects, and this can include weakness, nausea and vomiting, frequent urination, bone problems, and kidney problems, and specifically that you might form calcium stones. And so this is going to be when people are really just over supplementing. How we mentioned that 4,000 IUs for pregnant women. If you're taking that amount or even higher and you're not pregnant and you're doing it consistently for several months or years, that's when you might see some of these adverse side effects. And I think nausea and vomiting is probably going to be the most common one that people experience. But with even frequent urination, since vitamin D is not water soluble, you're not peeing out that extra. And so even though you're urinating, that vitamin D is still staying inside your body, leading to these adverse side effects. And just as it can be helpful for bone problems because it is having such a massive effect on your bone development, that's why taking too much can also lead to negative side effects. So risk factors for deficiency, like we mentioned, is the older you are, darker skin tones, infants being breastfed, just because if the mother is deficient, there's no other way that that child is getting in vitamin D if they are solely being breastfed. So that's especially important to make sure that you're looking at your vitamin D supplementation, not just during the conception and pregnancy, but also if you choose to breastfeed during that entire length of time as well. Because even most formulas, I believe, do not include vitamin D for the first few months of the baby's life. And it's only after they hit a certain month that they would start getting fortified vitamin D formula. Also, nursing home residents are someone to consider. If you have loved ones or friends who live in a nursing home, a lot of their time is going to be spent indoors and they may not be getting a vitamin D supplementation or a very diverse diet. So that's something to consider, is do they need a supplement? Are they having different symptoms of deficiency? Or even can they spend more time outside, maybe on a 15-20 minute walk just to get that sunlight exposure? And then also vegans are at risk for deficiency just because they are not consuming those fortified dairy products. So you want to make sure that you're getting it in other ways if you are trying to eat vegan. And so then we have a little game that we would like some interaction with, if you guys are willing. And so we just have a couple of different food options up here, and we're just going to ask you guys which ones are a good source of vitamin D. And so Melissa, if you actually want to take it over from here.
Hi again. Okay, so for this little game or participation activity, what I would love for you guys to do is we'll go through each option. And I would love if you guys could type in the chat what you think would be the better source of vitamin D. So starting off, we have nice, beautiful salmon or a delicious looking burger. Fish, salmon, salmon, salmon. Yep, you guys would be correct. I just gave away the answer. All right, for the next one, a glass of orange juice or Diet Coke. OJ, orange juice. Yep, it breaks my heart, but unfortunately, orange juice does have a significant more amount, if it's fortified, has a significant more amount of vitamin D than Diet Coke. And lastly, playing outside in a park or hanging out leisurely on the couch. Yep. Outside, again, it's being outside in sun with short sleeves on or shorts. Having the most skin exposed possible is a really good way to increase your vitamin D. So, perfect. And I dropped the link in the chat. And then lastly, if you guys don't mind just doing a post-assessment survey for us, let us know how we did. Let us know if you learned anything from this. Jess has just posted a link in case the QR code doesn't work. And we will just give you guys a few minutes to complete that. And then we'll do questions.
Thank you, ladies. Yes, while you guys take that time to do that post-assessment and drop your questions in the chat, I see we have one dropped in already that they'll be addressing here shortly. But I think great things that we don't always take into consideration of the importance of a variety in our diet and also getting a little bit of sunlight. Absolutely, the fact that, you know, how getting some sunlight regularly can affect our mood, that, you know, seasonal affective disorder, if, you know, kind of around the winter time, you're feeling, you got those wintertime blues or whatever, sometimes that can be with that we just don't get outside as much during those winter months, or we just don't see the sunlight as much. So that can play a part on our mood. So quite interesting stuff, how it all kind of connects in the information that they've shared with us today. So while you guys are finishing up, I'll go ahead and let you guys address any questions as well.
She had sent it 20 minutes
ago. Okay, if you guys are still working on those surveys, that's completely fine. We're going to start answering some questions that were dropped in the chat. The first question asked is, if my blood test showing my VD is normal, do I still need to take supplement of vitamin D? Jess already did a really good job of answering it, but I'll just say out loud. If your lab levels are fine, typically supplementation is not recommended. However, this is always something that should be talked about with your doctor. Any kind of supplementation goes for that. It's always beneficial to make sure that your doctor is within the conversation of that. How does sunscreen affect exposure to vitamin D?
It reduces, it's like having okay. So how does sunscreen affect sun exposure to vitamin D? So it's kind of like having an applied melanin, if that makes sense. So it blocks it, it slows down the production of vitamin D. So let's say if you yourself need 10 minutes in the sun to get adequate amounts of vitamin D normally, but if you have on sunscreen, then that time you have to spend in the sun would increase. How often? Next question. How often should we have vitamin D levels test to make sure it's normal? Whenever you do your checkup with your physician, like a yearly checkup or something, I think that would be best. Yeah, and also if you're an at-risk population, I would definitely say maybe more often, especially in the winter time. Let's see. When is the best time of the day to take a vitamin D supplement? You can take it anytime with the largest meal.
And with that, like fat foods.
Yeah, and with fatty foods, because vitamin D is a fat soluble vitamin. So taking it with your largest meal with the most fat would probably be most beneficial. Did I miss any questions?
I think they're at risk for skin cancer.
You're welcome.
How supplemental also So for how supplemental vitamin D is made, I cannot run you through it right now. There is, it's made out of cholesterol, and it is a fat soluble vitamin. However, if you are interested in the chemical processes generally behind it, there are explanations. If you look up how vitamin D supplementation is made, that will walk you through it. There are two kinds of vitamin D, D2 and D3. For the purposes of this presentation, there is not a specific one that we're recommending you take. It's just in terms of if you want supplementation versus natural exposure or foods. And then I think that we had another question as well as people at risk for skin cancer should take a supplement. And that kind of goes off of Tisha's answer as well. If you're wearing a lot of sunscreen, that is gonna disrupt the absorption of vitamin D from sunlight. So if you are worried in general about sun exposure and you are wearing a lot of sunscreen, that's definitely something to consider, is you're probably getting a lot less vitamin D, even if you go outside and you're tanning or you're just there and you have a lot of sunscreen on. So in that case, supplementation is probably more encouraged, just to make sure that you don't become deficient in trying to avoid skin cancer, which is also a very large concern, we're aware. And so, Laura, for what levels you typically start seeing the adverse side effects from taking vitamin D? Unfortunately, with that is you do not see adverse side effects from vitamin D until it's months or even years after over supplementation. So that's why they recommend you stick between that just a few thousand a day if you are supplementing, or even if you're eating it from food, that you're not overdoing that, just because there isn't an actual number that we can pinpoint and say, once you take all of this, you're going to have consequences, especially because if some people are deficient and they need to take 5,000 IU for a time, then they're not going to have the same side effects as someone who wasn't deficient and over supplemented for the same time. But we would recommend that, you know, that you're not passing that 4,000 IU, because if that's enough for both the pregnant mother and the fetus, that's definitely going to be enough for just any normal average adult. So when you buy D supplement, we have to make sure it's D3, right?
Hi. Okay. So when you are buying a vitamin D supplement, they are typically found in the D3 form, just because absorption is best at that level. I don't think you need to specifically search for vitamin D3, but you will see on the bottle that it says vitamin D3. And if nobody else has any more questions, thank you guys so much for your time. Oh, sorry. Say one more. Can I take D3 with milk? So luckily in America, vitamin D or milk is almost always fortified in vitamin D. So it's not typically needed to be taking a supplement while also drinking it. If you wanted to just wash the supplement down. Milk is fine, preferably a 2% or whole milk would probably be better, something with a higher fat content because it is a fat soluble vitamin. No, you're good. You did great. But yes, thank you guys so much for your time. It's been a pleasure.
Yes, thank you. I had fun talking to you guys.
Yes, thank you guys. And if you have any more questions, I believe our information is being sent out as well as these slides. So we'd love to talk more with you guys about it if you'd like. So thank you guys, and we hope you have a good rest of your day.
Wonderful, great presentation. Thank you, guys. Great questions as well. Yes, we'll be sending that follow-up email with the recording, the slides, and any additional resources. If you need to want to look for a registered dietitian, a little bit of information, as well as, like they said, a lot of great things to discuss with your physician, why it's always good to do those regular checkups. Certainly as we age as well, things to keep an eye out for. So thank you all and have a wonderful day.